Hello, my name is Jorge Gonzalez. Today I'm going to be talking about my shadowing experience at Encompass Health Valley of the Sun Rehabilitation Hospital. My P4 student was Perla Torres, and the pharmacist on duty was Daniel Lim. The Encompass Health Valley of the Sun Rehabilitation Hospital treats patients of all sorts of ages, ranging from young adults to geriatrics. In the hospital, they are in an inpatient rehabilitation center for patients with stroke, brain injury, hip fracture, and other complex neurological and orthopedic conditions. They consist of a team of physical, occupational, and speech therapists that include physicians, nurses, dietitians, case managers, and pharmacists that tend to meet the goals of the patients. Today, I'm going to begin with the daily activities of the P4 student. At the beginning of the day, they verify any new patients coming into the hospital by checking their med action plan, or in other words, history of medications. They verify that any drugs that they are currently taking on are not negatively affecting their health and are safe to use. Also, if any medications are needed, they make sure that those medications are provided to them as well. After they have looked into their profiles, they go to the patient's room, both new incoming and those that are currently there, to verify that the medications they are taking are working, are being taken as prescribed, and if their symptoms have been getting better. Towards the end part of the day, they look at patients' med action plans that are getting ready to get discharged from the hospital. This consists of verifying that the medications are safe to keep taking, counseling the patient how to use these medications, and make sure that they have the medications before they leave the hospital. My P4 student typically oversees 47 profiles, mainly consisting of geriatric patients. However, they are split between another P4 student at the pharmacy, which tends to alleviate her load quite a bit. So her typical day consists of a schedule from 8:30 to 5 p.m. The pharmacist conducts some of the duties already mentioned, but the suggestions that the interns provide are verified by the pharmacist before they go in to consult the patient. Once these suggestions get approved by the pharmacist, either the pharmacist can decide to consult the patient himself or leave it up to the interns to do it. Also, the pharmacists tend to oversee that the prescriptions being dispensed are accurate medications being given to the patients before they are giving out to them, and if they have no drug-to-drug interactions with any current medications. In order to succeed in other rotations, or the advice that they gave me in order to succeed in other rotations, was to restudy prior knowledge about past classes and do research about the setting you're going into. They also mentioned while in the rotation, try to retain as much information possible uh, while um, while in each rotation. Um, they also mentioned that every time one steps a foot, treat it as an opportunity to get a job in the future and to build connections with other pharmacists, thus leading to one being able to contribute to the pharmacy setting. So this is all I have for today. Thank you very much, and hope you have a good night.